I'm Tara Sklar. I'm a professor at the University of Arizona James E. Rogers College of Law, where I oversee our health law and policy program.
Hi, my name is Huong Huynh. I'm Director of Regulatory Science at Critical Path Institute, as well as Professor of Practice at the University of Arizona James E. Rogers College of Law.
At the University of Arizona James E. Rogers College of Law, we have a long-standing health law and policy program that within it has a graduate certificate in regulatory science. From the very beginning, back in 2019, we created the certificate in collaboration with the Critical Path Institute, which we refer to as CPAth. There are 2 courses now that we currently offer as part of the certificate with CPAth, and I am so delighted to be able to speak with Professor Huynh, who is the Director of Regulatory Science at CPAth, and she's been instrumental in offering these 2 courses every year within the program.
Thank you for this opportunity. Professionally, I have a PhD in pharmacology with the intent of being a professor at a university. So lucky me, I'm here now. After getting my PhD, I decided I wanted to get more understanding about the regulatory side of drug development as well as clinical side of drug development. So I spent 10 years as a reviewer at FDA, learning about the regulatory side, the guidances and the policies. And then after deciding to leave the FDA, I joined CPAth because it gives me a closer interactions with the clinical aspects of drug development. And so that has led me to the interest of regulatory science and how we could do research to improve policy and drug development tools to help the patients.
Yes, I remember when you came on board to CPAth and then joined us in the regulatory science program at the University of Arizona, and you really led for quite some time the course that I would describe as the flagship of the graduate certificate, regulatory science certificate, which is drug discovery, development, and innovation to reach the marketplace. So within that course, could you describe some of the topics that you cover and why you think they're important?
Yes. I believe that's a really interesting course, and it sets a foundation. I consider that as a foundational course, such that it introduces the students to why we have an FDA, why there's a need to regulate medical products, and understanding what products FDA does regulate. And it's beyond just drugs for humans. And so we get a history of FDA, and also learning the different stages and aspects of drug development. It's not in one day that you can get a drug to the market, but it takes years. And understanding the players in the community that contribute to drug development, how many people it takes, how much investment it takes, the dedication of the researchers to get this together. So the students will learn multiple things in terms of drug development in the US, drug development in Europe, as well as rest of the world, and certain regulations that are important throughout the endeavor and that are harmonized across the different regions that are encountering this process. So that is almost fundamental, so that they have an understanding to see why it is we do what we do at CPAth in terms of drug development tools, and then regulators as well. And then also to a certain aspect, what as a patient we can do, what questions we should ask as a patient going into the clinic, asking our pharmacist, is this the right drug, and things like that, to double check to make sure we're getting the right product that we're supposed to.
I love all the angles that you just presented in that snapshot, because it really represents a goal we have with the regulatory science certificate, which, as you know, the students are quite broad in their disciplines and backgrounds. And just as a little anecdote, when we first launched the program in 2019, our very first 2 applicants were a half century apart in ages. They were ages 22 to 72, and they had just a huge range of different career paths in between. And so quite a few are law students, as you might expect, being housed at the College of Law, but then we also have students in the basic sciences and biomedical engineering at the business school, and then across our health sciences sciences, particularly medicine, nursing, and pharmacy. So it's a large, diverse cohort that takes these courses, and excitingly, you're also now involved in the regulatory science case study project course, which I'll let you point out some examples there, but does importantly involve group work.
Yes, so that second course is very interesting as well, because it's almost like culminating in everything that the student is learning throughout the regulatory science certificate program. So it's bringing them together, one, to help collaborate and working in a group dynamic, but two, also to apply what they have learned. So learning about the drug development processes and the stages and the various regulations that regulate them. Now they put them together in a case study. For example, what happens if there's an importation hold on a product that you can't get it to the community in the US? So you can apply why it was on hold, what you need to do to stay within the laws to get it off of hold, and then also example in terms of emergency preparedness. Example from COVID, what did we learn from there that we can apply now to the general drug development process in terms of expediting reviews and manufacturing. So we actually have real life case studies, examples that the students can read and work together and taking different perspectives and learning from each other how they can see from a different perspective and putting it all together into a cohesive assignment.
Oh, that was a great summary of the course. Thank you so much. Well, in closure, who do you recommend would take these courses and overall the certificate in regulatory science?
Yes, so as you said, the extreme in terms of young and old students, I would recommend for those who are already in their career and their field, if they wanted to know more about regulations. Let's say someone in the manufacturing or the quality area of drug development. They want to know more about regulations so that they can help with strategy development within their company. They can take this Reg Sci course. And for new students coming out, let's say bioengineering students, there are needs and requirements for developing drug devices and diagnostics. So if they understand what and how to apply their bioengineering learnings to the regulatory space and how that can contribute to the public health, that can be an area as well.
Oh, that's great. Well, thank you so much for your time, and thank you for your leadership and being so instrumental to these courses in our program.